Free from heartache and pain. I wanna be free. Taking aspirin a day from the doctor way. I wanna be free from heartache and pain. I wanna be free. Taking aspirin.
Hello to all of our local viewers and those watching from around the world. I'm Dr. Wayne, and welcome to the Dr. Wayne Health and Wellness Show. Today we will be discussing hypertension with Ms. Katrice Mackay, physician assistant at Augusta University. Many of you, some of you young people may not know that Augusta University was at one time known as the Medical College of Georgia, a major teaching university for a great deal of doctors, nurses, physicians assistants located in Augusta, Georgia. So welcome, Ms. Mackay. It's a pleasure to have you today.
Thank you.
And we're going to kick off with an introduction with about her background. She's a graduate of Georgia Southwestern University, having obtained her bachelor's degree from there, and she went on to obtain her physician assistant's degree from Augusta University, which was formerly, again, it was Medical College of Georgia when she graduated from there. So again, welcome. And first and foremost, I want to talk to our audience also about what you did afterwards. What's interesting, so I'm going to let you share that with us.
Okay, I tell you, actually my first teaching job, because I actually was a science teacher prior to becoming a physician assistant, and I was actually a science teacher right here at this studio at the old A.S. Clark Middle School here in Cordele, and it was just exciting and awesome just to come back and see the transformation that has occurred. I loved being here in Cordele, and I'm just glad to be back here again.
We're glad to have you back. Glad to have you back.
Thank you.
So we're going to proceed with our discussion here today. You're a physician assistant,
Yes,
and you shared with us that you have a great deal of expertise in a lot of your experiences in the internal medicine aspect of the practice as a physician assistant. So you deal with a great deal of some of the common
Yes.
medical conditions of our citizens, such as high blood pressure, diabetes, things of that sort. So today we're going to discuss hypertension. So I have a few questions that I want to ask you about hypertension. What is hypertension?
Well, hypertension is actually a condition, in your body where the blood actually is forced too hard going through your arteries. And of course, if that blood is pumping through those arteries too hard, eventually something's going to happen. Something's going to happen, and we'll get to that something a little bit later, but that blood is just pumping too hard, and we actually can measure that. And so that's what hypertension actually is.
Okay. Good question, good explanation. As those have been watching our show, and we defined hypertension, it is very much in line with what she just said. So I guess we're getting something right. We get it from an expert clinician. Okay, what is the normal range that you deal with, a normal blood pressure that you like to see, or what the experts, what are they looking for when they say a normal blood pressure?
Okay. I like to use the word ideal, and nothing's perfect, but we'll say ideal. And 90/60 to 120/80. That's ideal. That's the ideal blood pressure. So any of that in between is your ideal blood pressure. And of course, anything over the 120/80 to 140/90, that is what we call prehypertension. And so with that prehypertension state, if we don't change some of our eating habits, our exercise, eventually we may go ahead to develop hypertension or high blood pressure, or what my great grandmother would say, she has pressure. But once it becomes over 140/90, many times medication is needed at that point. But we really don't want to think that a 90/60 is just too low. But for some people, that is very ideal. So 90/60 to 120/80 is our ideal blood pressure.
People in the audience, it says that we are doing something right on the show. To have it validated by an expert. We talked about those ranges in the show, and that's one of the things when we talked about vital signs, we gave that exact range. So it's good to see an expert, someone who's out in the field, who's seeing patients on a daily basis, and know that what we've been sharing with you is validated by clinicians in the field. So good. She gave the range of 90/60 to 120/80, which is exactly what we're talking about. And good to hear. Good to hear. So let me ask you this. Well, what are some of the conditions that occur if the hypertension is not treated? What can happen? Because many times people will have high blood pressure, and they won't treat or they won't take care of their blood pressure. They'll know their blood pressure is high, and the story that, well, I know when my blood pressure is high and I can do this. That's a common phrase. I know when my blood pressure is high and I know what to do. I need to get rid of the salt and I need to back off. I don't need to eat pork for a few days. But what are some of the common conditions that can take place when you're not taking care of high blood pressure?
Well, two of the major things that I'm going to talk about. Number one is what we call atherosclerosis. And remember I said that hypertension or high blood pressure is when that pressure of the blood is just going too hard on those arterial walls. And what can happen is if that pressure continues to keep going through there so hard, it can actually start to damage the walls of your arteries. It can cause them to build up plaques in there, which of course with that, if that plaque, decide it wants to break loose and travel somewhere else, and that's not a good thing if it travels to your brain, and then we could have a stroke that could develop, which is the next thing. And there are three types of stroke, and when it blocks like that, the first type of stroke is what we call an ischemic stroke. And so if that piece decides to just clot off and break up there, it can actually cause an ischemic stroke, where your blood supply is not getting to your brain like it should. Or it can cause what we call a hemorrhagic stroke, or where, because the vessels in your head, believe it or not, the pressure, goes through all the vessels in your body, not just the heart. You have other vital parts that it also goes through, such as your kidneys, and that's another story, but we got that question. Hopefully I can bring that out, as well. But if that artery in your head, that pressure gets too hard in your head, and it decides it's going to get so weak where it breaks open or tears open, then it can cause another type of stroke, or hemorrhagic stroke, where you actually have bleeding on the brain. Is what happens at that time. And the other type of stroke, some people call mini strokes, or what we call TIAs, transient ischemic attacks. And that's just where it just clots up just for a little while, blood supply to your brain, and then that little blood clot just kind of goes on and moves about its business, and it kind of just goes away. That's why they call it a mini stroke, because you don't have those side effects or residual things like with the arm weakness that kind of stays there. It usually kind of just goes away. But we just want to make sure and keep that blood pressure down. And what I tell my patients, Doc, is I tell them, I want your blood pressure as low as you can stand it without you feeling like you're about to pass out. And we're good. It does your body good.
Okay, good. Very good explanation. Let me go back to the TIA, and what she talked about was a mini stroke or light stroke. I want you to expound upon that again. When she said a stroke, remember we're talking about a compromised blood supply to the brain.
Right.
Okay. What happens? What are some of the clinical manifestations of a stroke? And then I'm going to come back with the TIA, so we all understand the difference, and we understand the difference in what a stroke with blockage of the brain and total blockage of blood supply to the brain versus what we call a mini stroke, and she used the term TIA, transient ischemic attack, so that we can understand, because you all are familiar with mini stroke. We've heard that term many times before. So I want her to expound on that a little bit more and talk about the difference. Tell us some of the things that you would see in a stroke, so that people can understand what's going on. What are some of the signs and symptoms of a stroke?
Now with a stroke, many times, a person may look like they're getting confused. They may have actual facial drooping. You may see the face actually start to go down, or you may see their arm, they may just start to just get weak and like they cannot move that particular side of the body. And that just won't go away. It'll just continue to progress and get worse and worse as time goes by. That's why time is very vital, because you want to make sure and get blood supply, to that brain and get them, to the hospital as quickly as possible. And with the TIAs, sometimes that person, and it's so amazing that you brought that out. My grandmother actually just passed a couple of months ago, and she would have little mini strokes. And many times, sometimes she would look like she's getting confused. Sometimes she would even kind of babble just a little bit, just hearing just kind of babbling. Some people may also get a little facial drooping a little, but it will go away. This is something that will go away. Many times, I don't see many times, the actual arm and leg, dragging and drooping. You won't really see that in a TIA, but just know that it's transient, meaning that it's coming and it's going to leave. But over time, you don't want to keep having that just back to back, because it still continues to damage those arteries. So you just want to be mindful with our blood pressures with that.
Good point that she's making here, folks. Again, the TIA is a mild form of a stroke, and the symptoms many times what we call reversible.
Right.
You understand? They're not long-standing and they're not permanent. Versus a stroke that causes major damage is not reversible. In other words, when she talked about the weakness of the arm, the drooping on you're not gonna reverse that. They're not gonna go back to a normal state. You see the weakness on the left side or the right side of the body, that's permanent. They're not gonna reverse from that. But the TIA is a mini stroke, and she talked about the weakness on the side of the face. She said that's reversible. It may come and go. Very good point, and very good distinction for our viewers. I'm glad you shared that with us. What are some of the treatments for hypertension without medications? What are some of the things you recommend that we can do without medication?
Without medication, I tell you, when I look at these different things that we can actually do, and I tell my patients many times hypertension is preventable many times. Not to say it's preventable for everybody, but for many of us it is preventable. Some things that we can actually do, and I actually jotted down some because there were so many more that I even shared with my patients. Of course, proper diet and exercise. Watching our sodium intake, a healthier diet, lower sodium, exercising. Even just exercising 30 minutes per day actually will lower our blood pressure by 5 to 8 millimeters of mercury, when you actually check, our blood pressure. And that's significant. That's very significant. Major difference. Just exercising 30 minutes per day. Another thing is stress management. And I don't have hypertension, but I need to manage my stress a little better. And with that, avoid stress triggers. Don't try to do too much. You can't be everywhere all the time. Sometimes you just have to say no. You just have to say no. Relax. Enjoy life. Life, we hear is so short. It's not just a cliche, it is true. Relax. Enjoy life. Learn to practice gratitude. Just being grateful and thankful actually helps to lower your blood pressure. And smile. Just smile. It's okay. Just to relax. Quit smoking if you smoke. Because of course that smoking will harden up those arteries, and we don't need any more hardening of the arteries, if we have hypertension on board. Decreasing our caffeine, which will help with our heart rate. Weight reduction, and with rate reduction of our, losing weight, that actually lowers our blood pressure by 1 millimeter of mercury every time we lose 2.2 pounds.
Ooh.
So if we couple the exercising and the losing weight, you're talking significant lowering of blood pressure.
Yes.
And many times, that's why I tell my patients, you don't have to stay on blood pressure medicine, especially when they're, overweight or obese. Many times, if we can just simply lose enough weight, you can see how those numbers can keep coming down. And once it gets down and we sustain an ideal weight or BMI, then we can many times come off of our blood pressure medicines, or at least some of them, so we don't take a handful. Maybe we only have to pick up a couple now instead of having so many pills to take. The other thing, we have in my clinics, what we call our chronic care clinics in my hypertension, diabetes, dyslipidemia, or cholesterol patients. I have to measure their waist when they come in, which is very important. And for my women, we like to keep it less than 35. I tell some of my ladies 30, but 35, we want to stay below that. And our men, we want to stay less than 40 in the waist. Anything above those numbers increase our chance for heart disease and heart attacks. So we really want to watch our waist. Some of us don't want to measure and know what it is. And I have my ladies and men, I put the tape measure on them, I have them to spin around, and I hold the thumb. I say, you tell me what it is. And they look, they're like, uh-oh. I said, that way it's kind of an accountability check. I'm just not telling them, no, they're seeing it for themselves.
Those are some very good recommendations. She talked about some very good points there. But let us take a break and we'll come back and finish with our discussion.
Dr. Wayne's aspirin is a low-dose tablet that promotes heart health while reducing the risk of heart attacks and strokes. Heart disease is the leading cause of deaths of Americans. Recent studies have concluded that a daily low-dose aspirin also reduces the risk of colorectal cancer. Taking low-dose aspirin is not safe for everyone. Only take low-dose aspirin if your doctor recommends it. Try Dr. Wayne's aspirin, coming to a store near you soon.
Welcome back to the Dr. Wayne Show. We're here today with Ms. Katrice Mackay, a physician assistant, and we're having a good discussion today on high blood pressure. We left off with her talking about some of the things, are African Americans more prone to hypertension than other races?
Actually, sadly, but it is true.
Mm-hmm.
It is so true. Actually, as far as compared to whites, we're 2 times at higher risk of developing hypertension. And out of all the races, we're at the top for developing hypertension. 2 main causes for that. Sometimes it's genetic disposition. And the other is our environment, or our habits, the way that we eat, our diet. I know down in the South where we are here, many of us are getting better. We're getting better at it, but we love soul food, or food that's very flavorful and very tasty. And many times, I know growing up as a kid, my great grandmother, you may hear me refer to her sometimes because I was around her a lot, and she would cook her greens and beans. The fattier it was, the better it tasted. And she would have fat back, or I would call it old meat. Why I called it that, I don't know. But that's what I would call it. But as I got educated, which is the key, education is the key, I found out that I can make my food taste just as good when I put a lot of garlic, a lot of onions, different herbs. And I learned that from another one of my grandparents. She cooked with a lot of herbs, and she was very fit and exercising and walking even at the age of 93. So I learned that, and I said, maybe if I take on that, that will help me out in this whole hypertension, diabetes, cholesterol fight that we have. And it really has. And it tastes just as good, if not better, to me now. It really does. And so that's what we have to do, is adjust our diet, but we are 2 times at higher risk for hypertension. And we do have to learn how to relax. As a race, sometimes we can get overly stressed of our environment. Our environment can stress us out, and that will play a part in our hypertension, when I say environment as well. So we've got to learn how to cope.
What are some of the common first lines of blood pressure medications? Now, we say that you gave us some things to keep in mind about when if we can control, we're not just really, the blood pressure is really not excessively above that 140/90. You gave us some things that we could do to get it back down. If it's close to that borderline, what if the blood pressure is up there and it's not time to put the patient on medication? What are some of those first line blood pressure medications that come to mind in your practice?
Okay. In my practice, 3 of the top ones that come to my mind are the thiazides, ACE inhibitors, and beta blockers. Those are the 3 that come to my mind in what I do. And with the thiazides, many people know or they've heard of HCTZ or hydrochlorothiazide or the water pill is what many people
That's what they know.
The water pill or the little peach color pill is what my patients say. They say the little peach pill, or my water pill. And I have to know what that is, when they come in, because many times they don't know and they won't bring their medicines in. But I tell them every time you come to see me, I need you to bring all your medicines with me. Bring everything with me. And so in regards to that, with the thiazide pill, it increases the amount of water and salt that actually is urinated out when you go to use the bathroom, thus lowering the blood pressure some. The other medication is an ACE inhibitor. Many times we use a lisinopril, as long as you're not allergic to that one. And because many times we see on Facebook, don't use lisinopril, it makes your lips swell, it makes, and that can happen to some people. It can happen. And sometimes it doesn't happen right away. It can be months or years down the line, and then it just starts happening. It just starts happening. And that particular class, it actually relaxes the blood vessels, so allowing the blood pressure to then be lowered. And the last class that I see and use, frequently in my practice is the beta blockers. Metoprolol or Lopressor is a common one that people, hear about. And that actually will lower, your heart rate and thus, relax. So your heart is not having to work so hard, and it's good, to use even after patients have had heart attacks, as well, to put that beta blocker, on there.
She brought up a good point about some of the medications, the side effects of some of them over a period of time. She talked about the ACE inhibitors, lisinopril. Many of us in the African American community are very familiar with that, because that's one of the ones that's usually very strongly recommended with the African American population, because it's better on the kidneys.
On the kidneys, yes, sir.
They're better on the
Yes,
kidneys.
sir.
But you did bring up an interesting point about sometimes people will develop these side effects, allergies to the medication, such as the swelling lip. But one that's long-standing that can develop over a long period of time too is coughing, a dry cough.
Yes, sir.
A dry cough with lisinopril.
Yes,
You
sir.
think that you're getting sick,
That's
and
right.
you're just coughing, all of a
And you're
sudden
just
developing
coughing.
a cough. Then one of the things that the healthcare provider needs to ask for an older person that's on high blood pressure medication, if you're developing a dry cough, is what are the medications that you're on? If you're on lisinopril and you've been on it for years, the dry cough may be related to the lisinopril, because that can happen.
Yes, sir.
Okay, we're going to take a break for now and come back with this great conversation here about high blood pressure.
The Black community experiences health disparities at a rate significantly higher than any other race. African Americans are more likely to die from many health complications, such as diabetes and heart disease. Wayne Pharmaceuticals is committed to closing the health disparity gap in our community by providing a variety of products and resources to beat the statistics. Join us in making a difference.
We're having a very great conversation today with Ms. Mackay, a physician assistant. We're talking about hypertension, and she's giving us some very good pointers, some very good information on hypertension. You go to these dialysis centers, and you see a disproportionate representation of African Americans. Let's talk about that as relates to high blood pressure. Do you see a relationship? Can you expound upon that?
Yes, and it's a direct correlation between dialysis patients and hypertensive patients. And with that blood pressure not being controlled for long periods of time, and I even tell my patients, it doesn't have to be 200s over 100 for a long time. It can just be riding at about 150 over 95 for just years and years. Nothing, over the top to make your nose bleed or anything like that. But year in and year out, I tell my patients, year in and year out, that force of the blood in those arteries inside of your kidneys, it starts to damage them, it narrows them, and it hardens them, and it decreases the blood supply to your kidney tissue. And basically your tissues in your kidneys start to die and they can't function. They won't, be able to purify, take out the toxins out of your body, and they don't work like they should. And so that's another reason why it's very important to get your labs checked, at least every 3 to 6 months, checking your kidney function, your BUN and creatinine. Make sure you know what that is. I tell that with all my hypertensive patients. That's a must. We have to keep a check on that. And if not, I tell them, you may wind up on dialysis one day if we don't get this under control.
Very good point, and that she brought up about the relationship with uncontrolled high blood pressure or hypertension and kidney failure. It's also in the medical community known as renal failure.
Yes.
Okay, you'll hear that term. But that was a good relationship that she was able to show with not being compliant with your medication, not only the other things that she talked about, but you could also use the functioning of your kidneys. Now, in our earlier discussion, you shared some personal situations with you as it relates to hypertension in your family.
Yes.
Would you like to share that with our viewing audience?
I will, and I don't mind sharing it because if I can share something that will help someone else. Right now, I actually have had to get permanent custody of 4 young girls. 4 young girls, because both of their parents are now deceased. Those 4 girls are my nieces. And their father was 36 years old, hypertensive patient. He would run to the hospital, nose bleeds, chest pain. Well, when it gets to that point, it's too late. When you hear people talk about, I know my blood pressure is high. Well, with the headaches and the nosebleeds come, it's out of control at that point. And that's when he would run to the hospital, year in and year out. Well, one year, about 6 years ago, he actually went into the hospital and had clots in both femoral arteries. They did surgery right away. Mind you, 36 years old. Well, within 24 hours, then his aorta, that blood vessel, the big one that comes off the heart, it started to dissect. It tore, it opened up, it ruptured because of the pressure of the high blood pressure. It was so high that artery, it just couldn't take it anymore. And it ruptured, and he died right there. And of course, later on, 7 years later, their mother passed away. So we have those children. But cancer, of course, you can't, you don't have a lot of control over. But hypertension or high blood pressure, at least one parent could have still been here had he taken his blood pressure medicine. He would not take his blood pressure medicine. And my takeaway from that is, think about your family. If you don't want to think about anybody else, just think about your family. Now we're having to raise 4 young girls. When they came with us, they were 14, 11, 9, and 7. And all my children are adults. My baby will be 19 years old sitting in the audience in here with me today, and a 30-year-old and a 23-year-old. So this is all new to me. And it puts a great strain and stress on your family. So if you don't want to do it for yourself, do it for your kids and do it for your family, to take your blood pressure medicine so that you just won't leave them behind.
Very good point. I'm glad you shared that with our audience, because you made it have a connection. And you talked about what the implications is very serious. It's deadly serious.
Yes, sir.
It's deadly
Yes,
serious.
sir. Yes, sir.
Not taking care of yourself,
Yes,
particularly your blood pressure, which is something that is preventable in most instances. Is preventable if we take control of our blood pressure, take control of our eating, exercising. If you're on medications, take your medications as prescribed by your doctors, and do some of the things that you can do to help lower your blood. But great conversation today. And again, thank you so much for being with us.
Thank you for having
Great
me.
show.
I loved
Great
it.
show. Great show. Thank you. And this is Dr. Wayne. Until next time, have a great day.